Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Stress urinary incontinence. Stress urinary incontinence is involuntary escape of urine when the intra-abdominal pressure is increased, such as sneezing, coughing, and laughing is stress urinary incontinence. The most common type of urinary incontinence in women is accounting to 50 to 70%. Causes of stress urinary incontinence include bladder neck descent, including the urethral hypermobility, that is seen in 75 to 80%, intrinsic sphincter defect seen in 20 to 25%. Mechanism: in normal function, in normal conditions, there is normal conditions there is increase in intra-abdominal pressure which compresses the upper urethra, resulting in continence. But in bladder neck descent, compression does not occur or incontinence does not occur. In bladder neck descent, the bladder neck has been come down. So as a result, even if the increased intra-abdominal pressure compresses the bladder neck, it is not sufficient to completely compress it. So this will result in incontinence or um stress incontinence.
thank you and thank you for watching.